My name is Diamond Woodson. I am a nursing student at Indiana State, and this is a presentation on advocating for telehealth to improve community health. Objectives: define telehealth, express practices and benefits of telehealth, recall the ethical pitfalls associated with telehealth, explain why advocating for telehealth is necessary, evaluate issues impeding the advancement of telehealth, and lastly, outline areas of advocacy for telehealth. You may want to pause this video to take the pretest so that you can evaluate how much you have learned. What is telehealth? Telehealth nursing practice is an essential component of ambulatory care nursing. Nurses used to be available to patients via telephone practice, which consisted of an audio phone call conversation. This ensured healthcare access to a triage nurse, which aided in providing appropriate care. Currently, high-level nursing is conducted using various telehealth technology in a virtual environment. The telehealth meetings differ depending on the setting and patient needs. Technologies may include mobile smartphone, kiosks, web-based, and/or digital platforms. Practices and benefits of telehealth. Nursing practices include assessing patient needs and symptoms by clinical protocol, guidelines, or algorithms, prioritizing patient needs, developing the plan of care with the patient, family, and other disciplines, making recommendations for care, providing care instructions, providing patient care teaching, and lastly, evaluating patient care outcomes. Benefits of telehealth include promoting optimum wellness, participating in management of acute illness, assisting in self-care management of chronic diseases and disabilities, providing care coordination during care transitions, and supporting patient and their families in the end-of-life care, and lastly, readily evaluating outcomes of care collectively. Ethical pitfalls include destruction of nurse-to-patient relationship. Most experts agree that 70 to 93% of communication is nonverbal. It is important to not let technology get in the way of ineffective communication. Another pitfall includes patient information is available on all types of devices and computers, which increase the risk of security breaches. To gain the patient confidence, it is important to use top quality privacy and security plans in companies. It is important not to impose a one-size-fits-all implications. As nurses, we know the importance of individualized and culture-sensitive care. Use this one-on-one time to truly connect with your patient and get an understanding of their mental and physical needs. And lastly, the nurse should not assume that the new technology is the most effective. It is important for the nurse to use critical thinking and evidence-based practice along the way. Remember, technology should be used as an aid and not a crutch. You are the healthcare provider, not the device being used. Why advocate for telehealth? Patients can access medical professionals, including nurses, from the comfort of their home. Nurses advise patients on many health concerns, providing primary, secondary, and tertiary care. Ultimately, telehealth is a great way to stay involved in the patient care. Studies show that convenience plays a huge role in healthcare management. The nurse is able to educate and provide health behavior model interventions and upstream approaches to tailor the patient needs. The nurse can stay informed with gradual or sudden changes in the patient's health status as the patient update any alterations in health on the app. This method can help the nurse evaluate trends which can improve overall health monitoring on a consistent basis. Issues impending telehealth include Medicare restriction coverage. Medicare reimbursement for telehealth services fall behind other providers. Medicare restrictions delay the development of telehealth services. Currently, patients living outside of rural areas has limited access to telehealth, as well as patients outside of the hospital or physician office due to limited coverage for telehealth services. Other limiting factors include only allowing real-time rather than remote monitoring. Telehealth is also limited to two-way conferencing. Changes needed include modification of geographic and setting location requirement, which will increase access to telehealth services to patients who have benefit from or could benefit from telehealth that live outside of rural areas or may need ongoing home care telehealth services. Also, there is a need to increase the type of technology being used, including off-site monitoring. All services safe to provide should be covered, which will aid in small list of approved services. Next, specific telehealth services are predicated on federal and state law and regulation. In order to provide telehealth services, healthcare agencies must be in compliance with a collection of federal and state rules. Challenges associated with law and regulation exist in the following areas: coverage and payment, health professional licensure, credentialing and privileging, online subscriptions including for controlled substances, medical malpractice and professional liability insurance, privacy and security, and lastly, fraud and abuse. There is also a need for additional research to evaluate the effectiveness of telehealth. Policymakers are concerned that increased spending may result from increased access to telehealth. Medicare programs conducted research that suggested these concerns are exaggerated, especially when taking potential benefits in quality, patient experience, and efficiency into account. Nevertheless, there is a lack of study on the cost-benefit of telehealth outside of a limited number of services, such as telestroke. Additional research is needed on other conditions and newer technologies, such as remote monitoring of patients. Lastly, the federal plan to expand broadband needs to be shortened. Broadband is the type of internet connection given by internet service providers. As cited by the AHA, the FCC highlighted that 34 million Americans still lack adequate broadband access. Moreover, there is a large digital divide with almost 40% of those living in rural areas lacking access. The issues discussed can be resolved by advocation. Advocate for adequate reimbursement that considers nursing and other costs, which requires an increase in Medicaid coverage, telehealth waivers in all of its validations, and adopt a more flexible approach to adding new telehealth services to Medicare should be included by the Center for Medicare and Medicaid Services. Secondly, advocate for resolution of legal and regulatory issues that delay the delivery for telehealth services. Promote conducting more research on the federal level to evaluate the cost benefits of telehealth. And lastly, support the enhancement of the Federal Communications Commission Rural Health Care Program, which will ultimately improve the access to broadband technology for individuals living in rural areas.